everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So I know last few weeks had been really tough for all of us. I too contracted COVID-19 along with few of my family members, but I have recovered now, and that's what is life. So we are back to work and we are back to our pregnancy series. So a few weeks back, we spoke about first trimester, and a lot of you actually requested me to do a video on the second trimester and the third trimester as well. So today we will be talking about the precautions, do's and don'ts in the second trimester. So as we all know that the pregnancy is divided into 3 trimesters. The first trimester is from the first day of the last menstrual period till about 13 weeks. And the second trimester starts from week 14 till the end of week 27. So the second trimester is actually supposed to be the golden period or the honeymoon period of the pregnancy, because the discomforts of the first trimester have actually by now disappeared, and all the major troubles of the third trimester have not yet begun. So did you know that by the end of first trimester, your baby already looks like a miniature human being with a small head, spine, hands and arms, and the legs already developing. By the end of the first trimester, the fetus actually is about 5 inches long and it just weighs about 50 grams. And by end of second trimester, the fetus weighs roughly about 1 kg and is now measuring roughly about 12 to 14 inches in length. This is the time major organs of the baby have now developed. The heart is functioning, the lungs have also developed. The baby has toes, fingers, along with the nails on it, and the baby also has fingerprints by now. And if you are lucky, when you go for your second trimester scan, you could actually see your baby sucking its own thumb. So did you know that the baby's ears have developed by about week 18? They become sensitive to the sounds by about week 22, and the baby actually starts responding to the sounds by about 24th week of the pregnancy. The baby may not be able to hear things very, very clearly because the baby is wrapped up in the amniotic fluid, and the baby has layers of abdominal fat of the mother in the front, but the baby can hear a lot of things. Who knows that old Indian mythological story of Abhimanyu listening to the father's story while inside the mother's womb could actually be true. And also, every mother knows how her baby kicks or moves when she listens to a particular sound. Did you know that what is that one sound which makes the baby very alert? It is the mom's voice. So it is very, very important that you talk to the baby. In fact, most of the babies actually respond by increasing their heart rate when they are listening to the sound of their mother. So did you know that the baby can see inside? In fact, by about 16th week of pregnancy, the baby's eyes can actually start seeing things. And by about 24 weeks of pregnancy, the baby can actually see a lot of things. So if you actually show a spotlight on the mother's abdomen, the mother can actually feel a little kick or little movement. In fact, it is said that by about 5th or 6th month of pregnancy, the baby can actually make out whether it is the daytime or the night time by seeing a red halo in the front. So did you know that the baby swallows its own amniotic fluid and also pees into it? So the amniotic fluid is actually made up of the urine of the baby. When the baby swallows this amniotic fluid, Many times it irritates the diaphragm of the baby, and that's how the baby experiences hiccups. Did you know that the baby starts moving by about 8th or 9th week of the pregnancy, which is so early, but the movements are so small that most of the mothers are not able to appreciate those movements. So in a first time pregnancy, the mother is typically able to feel the baby's movements by about 20 weeks. And in subsequent pregnancies, which means second or third pregnancy, the mother might be able to feel the movements earlier, which is about 18 or maybe 19 weeks, because she's experienced enough to know that yes, this is called the baby's movement. So now let's talk about what are the changes we see in the mother in the second trimester. So by this time, the first trimester problems like nausea, vomiting, altered taste, smells, and fatigue, all these symptoms actually start settling there. The mother's appetite improves, she starts to eat better, and now she starts to gain weight. In fact, you'll be surprised to know that 80% women actually lose weight in the first 3 months. By about 4th month, the weight just stabilizes. And typically after 5th month, now the weight gain starts happening. And after that, the woman typically gains weight at a rate of about 2 to 2.5 kgs per month. This is also the time when the baby bump starts appearing. I know most of the mothers keep asking me, man, when would my tummy show up? So typically women who are thin, the baby bump typically starts showing by about 5th month. Women who are slightly on a higher weight side, the baby bump typically shows up little late. This is also the time when a lot of changes in the breast start happening. The breasts, they become little bigger, they become more sensitive. You would actually see that the areola on the breast, it becomes darker, it becomes bigger, and you might also see some stretch marks appearing on the breast. So this is the time when actually you should be investing in buying 1 or 2 pairs of good, well-supporting pregnancy bras. Then let's talk about something which every woman is worried about during pregnancy. That's her skin. Many women actually notice slight darkening or the brownish pigmentation on the face. Now, this is known as chloasma or the mask of pregnancy. Many of you would actually notice a dark vertical line running just below the navel going up to the hairline. Now this is known as linea nigra. You all would actually notice darkening of the armpits, groin, inner thighs, and all this happens because of the hormonal changes. So let's talk in detail about the stretch marks. Now, stretch marks is something which happens when the skin is stretching. So stretch marks do not happen because of scratching. I know a lot of women actually ask me, ma'am, if I scratch, will I cause a mark? Yes, any kind of a scratching would actually lead to a mark. But these marks do not happen because of scratching. They happen because of the stretching. When the skin is stretching and beyond a particular point of time, it cannot stretch more, it breaks and hence forms a mark. So the amount of stretch marks which a woman would have would actually depend upon the size of the baby and her skin type. It has got nothing to do with any kind of a fancy cream or oil which you applied on your skin. And if at all you still want to apply something or moisturize the skin, you can apply something which is as basic as either a virgin coconut oil or maybe a simple desi ghee. Many of you would have actually noticed nasal stuffiness or even the nasal bleeding. Because of the pregnancy hormones, the mucous membrane of the nose, which is the inner lining inside the nose, becomes swollen up. So you actually feel very stuffy. So you can do steam, you can do a little bit of gargles, you can use also the saline drops in case you are still not able to breathe. You can use those Vicks and other inhalers also to decrease the stuffiness in the nose. Did you know that visiting your dentist once in pregnancy is very, very important? Dental infections are known to be one of the reasons of the premature labor pains. In fact, dental bleeding or the bleeding from gums is also very, very common in pregnancy. So in case that happens, please visit your dentist and make sure that you are cleaning your teeth, you're flossing, you're rinsing your mouth after every meal. Most of the women actually get troubled with the leg cramps in pregnancy, and the leg cramps typically trouble them in the evenings. So make sure during the day you are walking about, you are active, wear comfortable shoes, and at night take a nice warm or maybe a hot shower, slightly massage your legs and do some leg stretches. In case the pregnancy piles are bothering you a lot, number one, make sure that you do not have constipation. You can try doing what is known as sitz bath, which means take a small shallow tub, fill it with warm water, put a little bit of betadine into it, and then you can sit into it. You have over-the-counter piles medications or piles ointments also available. You can use them also. And in case they still do not become better, yes, you need to consult your doctor. Ask any pregnant woman and she'll tell you how she's bothered with the pain in her back. So the back pain occurs, number one, because when the baby is growing, the uterus is growing, it is putting pressure on your back. So number one, please do not worry too much about it. It is not really an orthopedic problem. What you can do is that make sure, number one, that you are physically active. You wear some comfortable low-heeled block or maybe block-heel shoes. You can tell someone to do a little bit of hot fomentation at the back. You can use over-the-counter pain relieving ointments also on the back. Make sure that you're taking the calcium supplementations and the vitamin D supplementations. And when you're sleeping at night, make sure that you're sleeping on your left-hand side and you can keep a pillow in between your legs also. And nowadays, actually, you have a lot of those fancy pregnancy pillows available to make you feel very, very comfortable. So many women actually get troubled with what is known as the round ligament pain. Now, this could be a sharp pain or a dull pain occurring either on one side or both the sides. And typically, this pain gets more when you're trying to turn sides in your bed. So, what are round ligaments? These are basically two ligaments which keep the uterus in place so that the uterus doesn't wobble front or back. So in pregnancy, as the uterus is stretching, the round ligaments also stretch to accommodate the growing uterus, which causes pain. So number one, please do not worry about it. It's a very, very harmless symptom. Whenever you are having this kind of a pain, try and take a rest, and usually the pain usually gets relieved by that. A lot of women actually get troubled with vaginal discharge in pregnancy and they're constantly worried about it. So remember, during pregnancy, because of pregnancy hormones, the vaginal glands, they tend to produce more discharge, which is normal. But in case the discharge tends to be reddish, greenish, or foul, smelly, or maybe curdy white, then that is a sign of infection and it must be informed to your doctor. Also, UTIs in pregnancy are also very, very common because the big uterus makes it difficult for the bladder to be emptied completely. It is very important for the UTI to be treated because UTIs or even the vaginal infections can be one of the frequent reasons for the premature labor. So, in case you have symptoms like burning, urination, pain during urination, or fever, make sure that you talk to your doctor. Now let's talk about what are the medical checkups which are done in the second trimester. So typically in second trimester, the doctor is going to be calling you once in every 4 weeks. And at each visit, the doctor is going to take a history, examine you, take your blood pressure, weight, clinically examine the size of the pregnancy, check for the baby's heartbeat. Roughly at about 18 to 20 weeks, we do a detailed scan, which is known as anomaly scan or also known as TIFA. The screening for gestational diabetes is typically done at about 24 to 26 weeks of pregnancy. It can also be done earlier in case you fall into a high risk category for developing gestational diabetes, which means in case you are in a higher weight side, you have a positive family history, or if you had a history of gestational diabetes in the last pregnancy. We also like to give certain vaccinations in the second trimester. Typically, at the beginning of second trimester, we give a flu shot. This basically protects you against the swine flu. And we like to give a plain tetanus injection, and then roughly by about 26 to 28 weeks of pregnancy, we give another shot which is known as Tdap. Basically, this prevents you against tetanus, diphtheria, and pertussis. And this is the time the usual supplements like iron, calcium, vitamin D, folic acid, and DHA are usually prescribed to the woman. So the second trimester of pregnancy is actually known as the fun time of pregnancy, where you can actually start celebrating the pregnancy. So this is the time you should be really happy, eat well, and do not worry about these small, tiny problems which keep cropping here and there. So we will also be soon coming out with the videos about the exercises in pregnancy, about exercises for normal delivery. So stay tuned in, keep watching our pregnancy series and enjoy yourself. And once again, if today you like this information, please do not forget to like, share and subscribe to Maitri. And I will see you soon.